Part of building a better Bay Area, we sometimes focus on the soaring cost of health care. Tonight, we have a truly extreme example.
Yeah, this is crazy. A Solano County couple went in for a rabies shot, and the bill from that simple visit to the hospital, more than $200,000.
They called the I-Team's Dan Noyes to investigate. $200,000 one shot.
Hard to believe. It was a couple of shots, but still, that's a lot of money. You know, Larry and Amma, each year, tens of thousands of people receive a series of shots to prevent rabies after possible exposure. It normally costs between $1,200 and $6,800, but not in this case.
And I couldn't see, so I'm squinting. And then it just had this awkward walk like this.
Eileen Aguilar was putting on her contacts in the upstairs bathroom of her Vacaville home when something startled her out of the corner of her eye.
Grabbed my glasses, put it on, and kind of went like this, and I was like, oh my gosh, it's a bat.
By the time her husband Al came up, the bat was crawling up the wall.
Of all things, it's behind the door, so then I had to go in and close the door. And just the bat and I were in there.
Al captured this little guy in a bucket, took it out to the creek, and released it. Even though neither of them had been bitten, their doctor recommended they get a rabies shot at the local emergency room.
They really didn't want to go to the ER. I just know it's expensive and it's a long wait. But she checked and she says, no, the first vaccination has to be done at the emergency room.
At the nonprofit North Bay Healthcare Vaca Valley Hospital, they had a simple 15-minute consultation, had blood pressure taken, no tests, no lab work. Then, injections with the rabies vaccine. The bill, more than $112,000 for Al.
It's like, this has got to be wrong.
$93,500 for Eileen.
It was just shock and surprise. I was looking at that going, this can't be. And then the additional bill started coming in as well. 3
follow-up visits for rabies shots at North Bay Health Clinics cost just $1,300. That first visit to the ER totaled $206,285.68. The Aguilars did not receive an itemized bill. It just lists emergency medicine. They assumed the major expense was sitting in a room for more than 4 hours waiting for their shots.
And they stuck us in the back room.
That's true.
That seemed to be an unused part of the ER. We saw a bunch of equipment and supplies in the back. And at one point I was thinking, did they forget about us?
The Aguilars signed this release form so I could discuss their rabies treatment with anyone. But North Bay Health's marketing director, Diane Barney, emailed, North Bay Health does not engage in the practice of discussing patient billing matters publicly out of respect for patient privacy. Barney also said no executive from North Bay Health would agree to be interviewed. Not her or the chief executive officer, the chief financial officer, the vice president of operations, or even the chief medical officer and chief quality officer.
But you're going to report on this, right?
Yes.
I can see the title now, the $200,000 bat.
I did discuss the case with Charles Ruprecht, one of the world's foremost experts on rabies. He headed the CDC's rabies program for 20 years, still consults for the World Health Organization. Ruprecht has seen reports of overcharging for rabies vaccines across the country, even the $48,000 cat bite, but never this much. He's worried this massive bill might dissuade other patients who need treatment.
That might cause them not to seek care. That may cause them to trivialize the event. And if that occurs because of socioeconomic reasons, and it was a real rabies case and it results in a productive infection, they're going to die.
The California Department of Public Health tells me they would get involved only if there was an issue with quality of care. The CDPH does not have a role in setting charge limits or ranges for services. The hospital is required to make their charges public. North Bay Health's online listing shows $547 for a rabies vaccine. I also checked with a state senator from the Aguilar's district, Bill Dodd.
When we found out from your office about this, frankly, we've already checked in with North Bay Health Center, just asking them how they possibly could justify this. Pretty outrageous.
Dodd says you should try to avoid the emergency room if possible. That's the most expensive health care we can receive. But from his position on the Senate Committee on Insurance, Dodd has a question about the Aguilar's insurance. Even with plan discounts, United Healthcare still paid more than $58,000 for the couple's rabies treatment.
How can it get this costly? And why would an insurance company not put up the same type of outrageous indignation, if you will, that I'm sure these people are feeling?
And so you have questions and you're actually looking into it, huh?
Absolutely.
The Aguilars wound up paying $3,500 out of pocket. The insurance company told me today that they are reaching out to North Bay Healthcare to address these excessive charges. Now, by the way, get this. The rabies expert said chances are that the bat was not infected. The couple should have kept it, had it tested for rabies, and may have avoided the shots in the first place.
But still, I mean, if you don't know, you want to get that precaution. And
yeah, I get that. I totally get that. Yeah.
But 200, I'm still
just should not
stuck
be
on
that
this,
much.
and no explanation.
Not at all. And I kept on going back at them, and really, you really should explain this. And no way. And they won't do it, even though I had that signed release from the couple.
Exactly.
They wouldn't talk about it.
I can't imagine that would stand at some point.
Right.
Once, well, you're shining attention to it right now.
And the lawmakers getting involved.
Yeah.
We'll probably have some momentum, hopefully.
Yeah.
Good.
All right. Thank you, Dan.
Thanks.
Wow, what a story. If you have a story for the ABC 7 News I-Team, call the number on your screen, 1-888-401-TEAM, or go to abc7news.com/I-Team.